Laura, thank you. Lots of fascinating methodological questions we might delve into, but also really interesting substance for this conference. Thank you. Derek, you want to take off?
Thank you very much, and good afternoon to everybody. I'm going to be talking about impact evaluation within the Cgiar as relates to the theme of this conference. In one sense, the Cgiar has a pretty good record of impact evaluation. We have literally dozens of studies that support the fact that investment in the Cgiar has been a very good investment. It's paid off very handsomely. We have one meta-study a few years ago putting all this together, showing that perhaps every dollar invested in the Cgiar gives you about $10 in return. Now that's the good news. The not so good news is if when we come to the theme of this conference on the impact of investment in the Cgiar on health and nutrition or vice versa, we don't have as much to show. And there are a number of reasons for that. One, of course, is it's much more complex to look at these types of impacts than it is to look at economic returns. We're looking at effects that in many cases are very long-term, particularly in terms of child nutrition. You almost need a life cycle of data. You're looking at effects both ways, complex interactions between health, nutrition, and agriculture. Many of them are indirect effects, and sometimes are unintended effects. And it's not very often we do impact evaluation looking at unintended effects. And many of them are quite hard to measure, particularly when we get into nutrition or pesticide poisoning. Nonetheless, I think we have some good examples out there that we can build upon. And let me just talk about two of the areas. One is on nutrition. And we just heard an excellent example from Harvest Plus on evaluating the impact of orange flesh sweet potato. I think that's really a good example of what we need to do more of in terms of the relationship between agriculture and nutrition. We have some other related work in the Cgiar also using randomized control techniques on quality protein maize. But even that example is at a fairly local level. It's a direct effect. And as we scale up, we need to think about much beyond the direct effects and some of the indirect effects through markets, and particularly market prices. We have some examples of that type of impact evaluation in the Cgiar, and I go back to a study, it's actually almost 10 years ago, looking at the impact of investment in crop genetic improvement, crop varietal improvement in the Cgiar almost since its inception. Work done by IFPRI, Bob Evanson and Mark Rosegran, looking at both the direct effects through incomes and indirect effects through employment and particularly through food prices. And they estimated, and they had a model to be able to look at the impacts on child malnutrition. And their estimate at that time was that without the Cgiar, we would have 15 million more malnourished children. Again, it's modeling work. Models have always got assumptions, and we can certainly do a lot more to improve upon that work today. The second area where the Cgiar has done quite a bit of work related to the theme of the conference is on pesticides, integrated pest management. And I think there's a very nice study, just picking out one of those from Erie. There's actually pioneering work done almost two decades ago by Prabhu Pingali, agricultural economist who may be here somewhere, and the Agnes Rolla, a medical doctor. So 2 decades ago, we had examples of economists, evaluation economists, working with medical practitioners to look at the impacts of pesticide use on rice, on health. And they went and did very detailed data collection on medical costs due to pesticide use and pesticide poisoning, as well as days lost from work. As I say, a very comprehensive analysis of that. And the nice thing is That was done 2 decades, or early 1990s. Nice thing is we've just published a study just last month looking at the impact of that work on pesticide policies and regulations in the Philippines. And there's a good ending to the story because I think it did have, and we were able to fairly convincingly show that the evidence, the hard evidence from this work, led to changes in pesticide policies in the Philippines, which essentially eliminated the most toxic pesticides, and actually also through changes in pesticide recommendations, a reduction in pesticide use by about 80%. So I think that's a really nice example of how getting the hard evidence can lead to changes and improved health outcomes. SIP, the International Potato Institute, has also done related work, and I think very good work, looking at the impact of pesticides and IPM on health impacts. So that's another area I think we can point to some success. But there's not much, and what we really need to do is do more work in this area. It's something that we're now, as the Standing Panel on Impact Assessment, very actively exploring, and we just put out a call for proposals 2 weeks ago, asking for proposals to look at impacts of agriculture on undernutrition. So let me finish up with where I see we need to go in this area, because we're clearly not only underinvesting in evaluation, but underinvesting in evaluation related to health and nutrition impacts. Clearly we need to, I think there's 4 areas that we need to improve upon. One is understanding, and that's the research to be able to understand the pathways and the links between agriculture and health and nutrition. That's really essential if we're going to do better evaluation. Second area is on data systems. We're doing a much better job now with household panel data sets on incomes and expenditures. Somehow we need to link in variables related to health and nutrition into those sorts of data sets so that we can really look at them in an integrated manner. Similarly, on the modeling side, on the macro side, the data on country level indicators of undernutrition, I think, is an area that we could greatly improve if we're going to track our impacts in this area. The third area to invest is in methods. I think we've got certainly got to move towards much more rigorous methods in this area. Use of randomized control trials, but they have also their own limits, and they can only be used in, I think they're particularly useful in the early stages of evaluation, much less useful in the later stages, but I think we're making good progress in a number of other statistical techniques that we can use in methods. But certainly a lot of work to be done on this. And then on modeling. As we start thinking about evaluation at scale, you're really forced into looking at models and using models and then integrating health and nutrition variables into modeling work, I think is an area where we need to advance. And finally, capacity for evaluation. I think this is a Cgiar, despite my earlier comments that we have a good track record. I think we're underinvesting in the whole area of evaluation. We need dedicated people for this work. They have to have particular skills. This is not something that you learn overnight. It's becoming a highly specialized area. And we need the resources to get the job done. I don't think Dan talked about the resources that underwrite that work, but I know it's an expensive exercise. So, but I think this is an area where we need to put more attention. And finally, just to bring us down to earth, I think we need to define reasonable expectations in this area. It is going to take us some time to build up the data and methods and so on, so we can really start to the next time we have a conference like this, we can really put a lot more evidence on the table on what's been the impact of Cgiar research on health and nutrition and vice versa. I think we're making progress, but we have a lot to do. Thanks very much.
Derek, thank you very much. Really interesting examples and a powerful agenda for the future. I would just comment from DFID's perspective. We have a strong sense of underinvesting in evaluation in all of our multilateral and bilateral programs and have a real appetite to invest more. Some figures suggest that we ought to be investing something like 2 to 5% of our programs on rigorous evaluation, and we are far short of that at the moment, partly because of a lack of good proposals. So I think there are opportunities. Let's turn then to Kyoko Munya, who's going to, from World Vision, who's going to talk about getting some of this into institutional change. Thank you, Kyoko.
Yeah. I'm going to be focusing more on, not on the methodologies of evaluation and all that, but what can institutions learn or reuse evaluation results to influence their future programming as well as policies within the institution. So I'm just going to use World Vision as an example of how we've used evaluation results, which have influenced how we are currently doing our programming, especially in the area of agriculture, nutrition, and health. World Vision is a global organization with operation in almost 100 countries, and we work in more federated network sort of way, and our work goes from advocacy as well as relief and also development. And I'm just going to focus mostly on the development aspect of it and also the advocacy piece. Agriculture as well as health has been one of the cornerstones of World Vision programming for the last almost 40 years. Nutrition has been kind of the missing link. And what has happened normally is there has been an assumption that nutrition is being taken care of in agriculture or in health. Over the course of time, a major evaluation was done for World Vision programming across the globe around 2003, 2005. And that link was actually clearly identified that there was actually a clear missing link there. And it was also found that as a child-focused organization, one of the main outcomes for our programming should be improving child well-being. Child nutrition was one of the major issues. But looking at the results from the agriculture and health interventions, it was clearly evident that this sector-based programming was not reaching that goal. So though we were doing very good agriculture work, we were doing a lot of good health work, there was still that aspect that malnutrition rates were not significantly changing in those areas. We were improving food security for the communities. There was improvement in health in many situations, but there was still insignificant changes in the nutrition. And this link was, why was it happening? And that evaluation kind of kept coming up in most of the projects we were doing across the globe. At the same time, we were also undertaking some grant-funded projects in a couple of countries. One was in 6 countries in Africa, and it was intentionally focusing on nutrition, but it was an integrated program with agriculture as well as health component. But there was an intentionality of bringing agriculture for a nutrition-based outcome. And these programs clearly showed an improvement compared to our overall programming. And the question was, why was one showing this and the other? And that's where the missing link actually, or the sectoral divide, whereby nutrition was not intentionally being programmed as a program per se. And even to today, we still don't intentionally program nutrition in most of the areas. But the reality was, when the designs for agriculture programs was being done, nutrition was not considered as one of the outcomes. Likewise, in health, there wasn't a very clear link on how nutrition would be impacted at the end of it. And these two evaluations, the evaluations for our normal programming as well as for this grant-funded program, kind of brought out some key lessons for the organizations, which have been used to influence how we are programming. At the moment, nutrition is one of the global outcomes for World Vision programming across the globe. All our programming focusing on children have to show an improvement in nutrition as one of the major outcomes. And this kind of came out from all these evaluations that were being done across our programming, showing that there was actually a missing link with our programming in agriculture and health. some of the key lessons that we got from here, I'll mention a few. There are many lessons, but some of the key lessons that we got from these evaluations, some were opportunistic, but others were well in line with what we were doing. And sometimes things happen and you have to take advantage of them, but if you're not prepared, you actually cannot make the change. One of the things that came up was the translation of these nutrition evaluation results for specific and effective decision-making was very instrumental for us to make this change. The assumption is always that people will understand what the results of an evaluation are, but the reality is not the case. You find senior people in the organization may not have a very clear understanding of you tell them, in this program we had malnutrition rates of 35 or 40%. It doesn't make sense. You have to translate that into a language or into figures that they can understand. And that kind of was how we were able to actually make that institutional change, because there was a core team of people who are working with this information to try and influence the senior leadership by showing what was at stake, that this is the reality. We are investing this amount of money into these communities, into these programs, but you're not getting the results we're expecting. So there was kind of a disconnect between our investment and what we expected to come out of. So the translation of that information at the institutional level was effective in making those changes. Vice versa, the same thing, translating evaluation results for the programming people in the field. Again, there's an assumption that programming people in the field will understand the same thing. They don't. In most cases, you'll find nutritionists, we don't have that many nutritionists in our programs. And so when you give an evaluation results that shows malnutrition is this rate and this rate, people don't really understand what exactly does that mean for my program. What is the reality of what I'm doing on the ground? So in most of our programs, you find agriculture-based people are mostly the managers. And so you come in with very clear indication of nutrition. There's a problem of malnutrition in this community. Well, how does that person understand what exactly does that mean? I'm actually from an agriculture background, but I've worked with nutritionists a lot, so I can make some sense of all that information, but I can't say I'm an expert in nutrition. And so one of the lessons that also was, how do we translate the information from evaluations of nutrition program for people who do not have a nutrition background, who are implementing programs that are supposed to actually have an effect on nutrition? Because programming decisions the future programming decisions in areas that have shown they have high malnutrition rates need to actually take nutrition, intentionally target nutrition as one of the outcomes for agriculture, which in most cases was not happening. So that's one of the things. But at the national level also, the same thing, translating information, evaluation results for national policy decision makers so that they are able to make decisions that will actually translate this nutrition or programming interventions to improve nutrition in their countries. And that's kind of the divide we find. Results come out, good evaluations are done, but the translation of that information into ways that people who need to make decisions, either programming or policy decision or institutional decisions, do not actually understand that. So that translation is one of the key links that we found was missing. The other aspect is the invisibility of malnutrition. If you go to communities where there are most development workers, and I've done that myself personally, actually here in India, I remember visiting one of the programs you have here in India, in Bihar, and as we were discussing, I asked one of the staff we had there, what's the malnutrition rate in this area? And he said, okay, 42%. What does that mean for you? He had no clue. He had no clue. He knew the numbers, but he had no clue what it really meant. He couldn't translate that into any programming decision because it didn't make any sense to him. And that's the problem, because malnutrition is actually invisible in most communities. You ask people, why are children here short? They're always short. All our people here are short. So, but if you come in with the evaluation result, it shows that stunting is a problem here. But if everybody is short, and from if development workers themselves are saying people are short in this community, that's how it is. It becomes a challenge. How can you actually make changes? And so that's one of the things. The invisibility of malnutrition requires that we actually take efforts at trying to increase investment in training people who have a nutrition background, or even trying to cross-train people in agriculture to understand what are the implications for high malnutrition rates in their programming areas. The other thing I would want to talk about is sustainability of agriculture program interventions and the nutrition benefits which accrue from that. from most of the programs, actually, you'll find as long as the program is funded well and going on well, the interventions are going on. Once the funding ceases, either the interventions go down or the nutrition benefits that were accruing from that agricultural interventions actually start declining. And how do we sustain that? One of the things is actually education, educating communities as well as educating the program staff in ensuring that there's a sustainability, not only of the interventions that are making positive changes in nutrition, that's agriculture interventions, mostly food-based interventions, but also for those nutrition outcomes that are arising out of that. So how do you sustain that? That's mostly through education, both for the staff as well as for the communities. The other piece that also a key lesson that came out of this was integrated approaches will need strong coordination as well as shared funding and monitoring between them. This is one challenge because as much as we talk a lot here, and there are many donors talking about here, most donors still fund sector-based programming. I'm having that challenge myself at the moment. We are trying to write a program on food security, but we want to have a nutrition outcome, and we are having a challenge trying to meet the donor requirements for that, because the donor wants you to have a specific outcome on increased productivity, not nutrition. Say nutrition is a different area. So that's the challenge also. You find that though you may have good ideas, sometimes you also, if the donor is calling the shots, you have to focus your interventions in a way that may not actually meet what you really want to achieve. And so that's one of the major challenges you also find. And one of the major lessons we got, that the integrated approaches will need a very coordinated, but also shared funding between the sectors as well. The other thing I just want to bring was the issue of making nutrition as a clear outcome in agriculture programs. That's something that is still, in many programs, not very clear. People still resist making nutrition an outcome in agriculture programs. It doesn't have to be in all, but we need to have nutrition-sensitive indicators in that agriculture program to be able to actually address malnutrition issues. The other piece that comes with that is there's actually kind of a disconnect sometimes between the assumption that increased productivity will actually lead to improved nutrition. That doesn't always happen. There's really no direct causal effect. There must be interventions in between that will actually address the malnutrition. But the challenge also is that the lack of practical agriculture nutrition indicators that can actually show that. So that's always a challenge, because the current indicators are either very nutrition-based or very agriculture-based, and trying to find indicators that can cross that. There are few, but they are not very well utilized by most programs. So that's the other challenge that we find in trying to influence programming using evaluation results. And so these key lessons actually provide a way for us as an institution to be able to make some changes in our programming to ensure that we are sharing funding between sectors rather than having sectoral just funding. There's more integrated funding to support our programming, agriculture, health, and nutrition. But overall, also trying to ensure that we are communicating this information both to the programmers but also to the decision makers to ensure that good decisions are made to ensure that nutrition is catered for in all these programs. Thank you.
Thank you. Really, really useful story with some good lessons in it. Ladies and gentlemen, we are blessed by having some time for discussion, which is good news, because I expect there will be some questions. Before we turn to questions, I'm going to warn speakers, please, that I'm going to do a summing up session in the next plenary, and the risk is that I will just expose my own prejudices. So to minimize the risk of that, if you would write down on a piece of paper your 3 main points you'd like to have in the summing up session, that would be helpful. So that you don't just hear my prejudices. Right. I think we'll take questions then, sort of chunks at a time. We have a couple of microphones, so we'll take them in geographical clusters, and the gentleman near the door can begin. If we can get the microphone over there, thank you.